Hello, everyone. It's your girl, Dr. Elizabeth Ilo. I'm a registered pharmacist in the state of Illinois. Today, I'll be continuing my lecture series on diabetes. So, last week, I spoke to you guys about diabetes. What is diabetes? What are the signs and symptoms, or what are the clinical presentation for someone to actually notice before that person even going into the hospital to check if they actually have diabetes or not. I explained all those signs and symptoms to you. And I also talked about the risk factors that predisposes someone to having diabetes. If you missed this video, you can go back to my Facebook page to watch this video to learn more about these topics. So today we shall be talking about the diagnostic criteria of diabetes in non pregnant patients, that is, patients that are not pregnant. What are those criteria that we can use to diagnose those patients as having diabetes? And we shall also be talking about diagnosis of gestational diabetes. Like I explained to you guys in the last video, gestational diabetes is diabetes in pregnancy. So for women that are pregnant week between 24 to 28 weeks of pregnancy, if they're having some of these criteria, they can be diagnosed with gestational diabetes. We shall be talking about this uh, criteria. I'll end this video by answering some of the questions that you have concerning this topic. I'll be answering this question in the comment section. Post your questions and I'll be there to answer them. Now, let's get started. Now, we are going to start with talking about the diagnostic criteria of diabetes in non pregnant patients. Now, there are three criteria that has to be met. That's any one of these criteria has to be met for someone that is non pregnant, that is not pregnant, to be diagnosed with diabetes. The first criteria is one, if a patient is having a fasting blood glucose that is greater than or equal to 126 milligram per deciliter, or if a patient is having a random plasma glucose that is greater than or equal to 200 milligram per deciliter, that patient can be diagnosed with diabetes. Now you may be asking, what is? Now you might be asking, what is a fasting blood glucose? A fasting blood glucose, or when you say a patient is fasting, means that the patient wakes up in the morning, the patient has not eaten between 8 to 14 hours that morning, and he or she comes into the clinic. We conduct a we draw his blood to take his blood glucose test. Now, if this is greater than or equal to 126 milligram per deciliter, that is called a fasting blood glucose. That patient can be diagnosed with diabetes. Or if you've eaten that morning and you walk into the hospital or you walk into the clinic and your blood glucose is being checked, if you have a plasma glucose level that is greater than or equal to 100, sorry, that is greater than or equal to 200 milligram per deciliter, you can be diagnosed with diabetes. The second criteria is a 2-hour 75-gram glucose tolerance test. That means this patient must be fasting. He or she comes into the clinic and 75 gram of glucose is given to that patient. The patient drinks it. 2 hours later, if your blood glucose is measured and your glucose level is greater than or equal to 200 milligram per deciliter, that patient can be diagnosed with diabetes. The third criteria is if your hemoglobin A1C level is greater than or equal to 6.5%, you can be diagnosed as having diabetes. Now you might be asking, what is hemoglobin A1C? Hemoglobin A1C is the sugar that has been attached to your red blood cells for the past 3 months. It measures how much sugar has been attached to your red blood cells for the last 120 days, which is 3 months. That is what is called your hemoglobin A1C. Now, if this hemoglobin A1C level is greater than 6.5%, that patient can be diagnosed with diabetes. Now, let's talk about diagnosis of diabetes in pregnant women, which is called gestational diabetes. Now, this test is normally conducted when a woman is between 24 to 28 weeks of pregnancy. But in patients that are high risk, let's say you have relative, maybe your first relative, your mother or your father has diabetes, or you even have diabetes before you became pregnant. This test can be conducted earlier than that within your 15 weeks of pregnancy. But if you're not high risk, or if you don't have this um, risk factor before becoming pregnant, then gestational diabetes tests can be conducted between 24 to 28 weeks of pregnancy. This test, gestational diabetes test, is divided into two stages. And the first stage, or the first criteria, has two steps. Now, the first step is that the patient comes into the clinic and we give her 50 grams of oral glucose. And 1 hour after she drank this oral glucose, her blood sugar level will be tested. If 1 hour after drinking this glucose, if her blood sugar level is greater than or equal to 140 milligram per deciliter, then in order to be sure, we'll take the second step. So that is why it is called a two-step method. So the second step, the pregnant woman has to meet any two of these criteria in order to be diagnosed with gestational diabetes. Now, in this second step, the pregnant woman needs to be fasting. So that means she can either come into the clinic the next day after the first step for us to carry out the second step. While she's fasting, as soon as she comes into the clinic, we check her blood glucose level. If this fasting blood glucose level is greater than 95 milligram per deciliter, this is one of the criteria. She can be diagnosed if we take her blood glucose level this 1 hour after she drank 100 gram of oral glucose. 1 hour later, if her blood glucose is greater than 180 milligram per deciliter, already we've known that her fasting blood glucose was greater than 95 milligram. And then 1 hour later, after we give her the blood glucose, we check her sugar level, and we saw that it is greater than 180 milligram per deciliter. Then we can diagnose her with gestational diabetes. Or if 2 hours later her blood glucose level is greater than 155 milligram per deciliter, that means we've done her fasting blood glucose. It was greater than 95 milligram per deciliter. And then 2 hours later, after we gave her 100 gram of oral glucose, if her blood glucose level is greater than 155 milligram per deciliter, then she can be diagnosed with gestational diabetes. Or if 3 hours later, after this pregnant woman drank the 100 grams of oral glucose, if we check her blood glucose level and it is greater than 140 milligram per deciliter, then she can be diagnosed with gestational diabetes. Now, this is a two-step method of diagnosing gestational diabetes. Now, let's talk about the one-step method. In this one-step method, the woman also needs to be fasting. Fasting is required. And it can be done between when the woman is 24 to 28 weeks of pregnancy. She comes into the clinic, she comes to the hospital. We check her fasting blood glucose level before we give her anything to drink. If it is greater than or equal to 92 milligram per deciliter, then we give her the seven. Now the one step method, we what we give the pregnant woman to drink is 75 grams of oral glucose. She drinks this 75 grams of oral glucose. 1 hour later, if her blood glucose level is greater than or equal to 180 milligram per deciliter, then she can be diagnosed with gestational diabetes. Or if 2 hours later, after drinking the 75 gram of oral glucose and her blood level is greater than or equal to 153 milligram per deciliter, then this pregnant woman can be diagnosed with gestational diabetes. I hope you're able to learn something from this lecture today about diagnosis of diabetes in non-pregnant patients and diagnosis of diabetes in pregnant patients. In pregnant patients, there are two methods that need to be done. The first step, the first method has 2 steps, and the second method is just 1 step, all with different level of glucose being given to the pregnant woman. In my next lecture, I'll be talking about what are high blood sugar levels. How do you know your blood sugar is high? What is the normal range of a normal blood sugar level? And what is the range when a patient is being termed to be pre diabetic? Or what is the range when a patient is being termed diabetic? So, watch out for my video as I'll be talking more about this topic. I hope you are able to get something educative from this lecture. If you have any questions concerning this topic, you can put it in the comment section and I'll be there to answer all your questions. Thank you for watching and stay tuned for the next episode.